Hello everyone, welcome back to my channel. I am Shubha here. I hope you like this video. Please do like, share, comment and don't forget to subscribe. Today's topic is International Patient Safety Goals. There are 6 patient safety goals. Goal 1. Identify patient correctly. Goal 2. Improve effective communication. Goal 3. Ensure correct site, correct procedure and correct patient surgery. Goal 4. Improve the safety of high alert medication. Goal 5. Reduce the risk of healthcare associated infections. Goal 6. Reduce the risk of patient harm resulting from falls. Goal 1. Identify patients correctly. There are 2 approved identifiers: patient full name and patient medical record number or UHID number. Patients are identified before performing diagnostic procedure and providing treatments and other procedures. For the patients who is in condition of in where he or she is unable to confirm their name, that type of patient could be named as unknown 1 and 2 and generate UHID. Goal 2. Improve effective communication. Conditions for verbal order: life-threatening situations, serious nature of patient conditions such as that if medications is not administered, it may lead to permanent harm or even death of the patient. Anti-diabetic drug orders and reporting of critical test results. Follow of verbal order. If consultant is giving orders telephonically, then we have to follow read back policy. Receiver documents complete orders. Receiver read backs the message as he or she has heard, written and interpret it. The sender or the individual giving the order confirms that such recording and interpretation of the order is correct and document it. Handover communication for both doctors and nurses have to be maintained. Situations of handover: during shift change, interdepartmental patient transfer, inter-hospital patient transfer, shifted to OT and shifted from recovery area. The communication policy to be followed is according to ISBAR. Introduction, situation, background, assessment and recommendations has to be documented. Goal 3. Ensure safe surgery. Site marking to be done by the person performing the procedure. Time out has to be followed. Practice and adherence to usage of WHO surgical safety checklist and use of procedure safety checklist for medical and dental procedure outside the OT. Timeout procedure. The team has to check and recheck for the following: patient identity, procedure to be performed, site of the procedure noting the position of the patient, presence of images properly labeled and displayed, presence of required implants and any special equipment, availability of correct implants and any special equipments or special requirements. Goal 4. Improve the safety of high alert medications. During dispensing, indent need to be verified at least by 2 persons. During storage, high risk medications need to be stored in a separate highlighted place. Often use red color and these drugs should be locked. During documentation, all high-risk medications need to be highlighted when documented. These drugs should be easily recognized. During administration, when administering high-risk medication, staff has to follow 5 rights of medication. During monitoring, all indicated high-risk medication need to be monitored after administration. Goal 5. Reduce risk of healthcare associated infections. The following are to be kept in mind to reduce the risk of healthcare associated infections. Hand hygiene, bundle care for VAP, COTI, CLEPSI and SSI, biomedical waste management, cleaning, disinfection and sterilization, cleaning surveillance, swab cultures of critical care areas and standard precautions, etc. Goal 6. Reduce the risk of patient harm resulting from fall. Reduce the risk of slip, trip and falls in the organization because slip, trip and falls lead to sentinel events. Proper fall risk assessment need to be done for each patient. Vulnerable patient should not be left alone. Side rails should be open. Frequent monitoring needed for vulnerable patient who is having fall risk. All wheelchairs and stretchers should have safety belts. Patient and family education on slip, trip and fall has to be given. Facility rounds on defined intervals. Regular maintenance of all securities. No manhole should be left open. The terrace area should be covered with 4 feet boundary. Terrace area should be accessible by authorized personnel only. I hope you liked my video. Thank you for watching.